All right, welcome everyone to Let's Talk Business podcast with TriCounty Regional Black Chamber of Commerce. I am your host, Howard Johnson, the Vice President of TriCounty Regional Black Chamber of Commerce. Today I'm sitting here with Ms. Jennifer Roy. Ms. Jennifer Roy, please introduce yourself and let everybody know what it is that you do.
Okay. Good morning, everyone. My name is Jennifer Roy. I am the owner administrator of Midtown Hospice.
Okay. What is Midtown Hospice?
Midtown Hospice is a community hospice that provides services in the comfort of your home. We bring hospice services into your home, which means that we have a doctor on staff, a nurse, a chaplain, a social worker. That's what our team consists of. We provide medical equipment and supplies. We accept multiple insurance companies, i.e., Medicare, Medicaid, veterans insurance, Molina, and then a lot of the Medicare replacement plans we can accept as well.
Okay, perfect. So anybody that needs hospice care, then Miss Roy is the person to contact. Miss Roy, how can they get in contact with you?
Our office number is 713-874-1234, or they can email me at jroy@midtownhospice.com. Once again, jroy@midtownhospice.com.
Okay, well, we're going to take a break, but just hold that thought. I'm going to come back with some more questions. First, I'd like to thank our sponsors. We couldn't do this podcast without our sponsors. That's Amico Federal Credit Union and Enlighten Enterprises. Also, Southwest Airlines is a proud sponsor and member of the Chambers. They've been with us for a very, very long time. They help support us. And if you are interested in sponsoring, we're always looking for sponsorship. You can contact us at 832-875-3977. That's 832-875-3977. So, back to Miss Roy. Miss Roy, so what prompted you to start this business? And I ask these questions because this is a Let's Talk Business podcast. This is to get information out. So it kind of gives people an idea of, not even an idea, it gives them a blueprint. Somebody, you may tell your story and someone listening may be in the same position that you were in when you decided to start it, and it may give them the courage or the information that they need to go ahead and push forward and start whatever business it is they're looking for. So that's why I asked these questions. So
Okay. So what prompted me to start Midtown Hospice is that I saw there was a need for minority companies that
Okay.
were owned, not so corporately owned and corporately ran. So, for instance, if there's a major decision that needs to be made, then we don't have to go to supervisor here, there. I'm available and involved with every aspect of the company.
So it makes it a more intimate setting when it comes to. Okay,
Yes,
that's perfect. And you said it's minority owned as well.
absolutely.
Okay, all right, perfect. Everybody, we have a business book that came out, and I actually was flipping through the business book, and I saw this ad that was in there. Let me pull it up. Where is it at? It's hiding from me now. But it's this one right here. See, look.
Yes, that's our Midtown Hospice.
So, hey, Chambers members, we have a big network. We have our business book, our 2021 business book that's out. Please pick up this book if you haven't got yours. I may be ahead of the time. Ms. Thompson didn't tell me if it's ready to distribute or not. I just got my copy, so contact Ms. Thompson to see if it's ready to go out. But we have full page ads up here of business members that are members of the chambers that purchase pages in here. And then, Ms. Roy, you're on our advisory board as well, correct?
That's correct.
Okay. And just tell us more about hospice. Like, I didn't know what hospice was till about 2004, and I had a cousin who had stage 4 cancer, and that's when I was introduced to hospice, and I think I was at a disadvantage because I knew nothing about it. So just kind of tell people what hospice is, not Midtown Hospice, but
Just
hospice
hospice
itself.
in general.
Yes.
Okay. So hospice is end of life care.
Hmm.
So we say end of life care. We have many patients that come onto hospice that are discharged from hospice because they improve.
Okay.
So when you think of hospice, especially in our community, because we're not aware of what hospice is, as you said, you just heard of it, in 2004. Uh, when our loved ones are diagnosed with cancer or some type of terminal illness, then we want to, when they say there's nothing else that can be done, then we want to, if the doctors say hospice, then sometimes we run away and say, no, hospice is going to um, actually speed up my loved one dying. No, what hospice is going to do is we're going to support you, not only your loved one, but the family. So we provide comfort care for your loved one that they won't, when they are heading in the direction of expiring, we are there to comfort them and comfort you as well.
Okay.
So it's more of comfort care and to see your loved one die with dignity and support, not just watching them suffer. We manage pain. We manage when they're short of breath in the middle of the night. Then we're there to walk you through that, what needs to be done. We have nurses that are available 24 hours a day. So we're there to support you, be it spiritual support, physical support, pain support, breathing. So we manage all these different areas. We help with funeral arrangements, other communities, resources that may be needed. So.
And that's really good. One thing I did notice is the word hospice is very close to the word hospitality. Are they? I see hospitality as comfort. I see it as something that is hospitable, something that provides relief. When I think about hospitality, I think about relief. I was like, okay, that was great hospitality. I enjoyed myself. It was enjoyable. It wasn't like I was pulling teeth to get something done. So that kind of, the word hospice kind of, reminded me of the word hospitality. So, and then you say it's for comfort, it's to provide comfort for the family. So I think that's a really, really, really good thing, man. A lot of people don't think about death. They don't think about it until it's at their doorstep and knocking. And the funny thing is, me and my father's 89 now, and he's still alive, still doing well, still in great health. But we spoke about it. We talked about it. He was like, hey, look, when I go, I don't want nobody standing up over me, having this big old hoorah. I don't want nobody preaching over me, none of this, none of that. So he's kind of giving me instructions on how he wants things when he does decide, or when God decides to take him away. He was like, listen, I need A, B, and C done. I was like, man, I don't want to talk about that. You ain't going nowhere. He was like, no, we need to sit down and talk about this.
It's really good. Yeah, you're very blessed that your father is willing to talk about that, because a lot of people are not.
And do you experience that? Do you experience that a lot of people are shying away from talking about, I can't even call it a possibility, because that is the inevitable is happening. Everyone that is born has a day that they will leave this physical earth and this physical body. So do you find it, my question is, do you find it that a lot of people are afraid or nervous or bothered about talking about death?
Some people are. But I think that it's becoming more in vogue where people are willing to talk about it. I know that for me and my family, we talk about it all the time. So I have my funeral planned of what I want and what I do not want. So with organ donation, all these different things. So it's a regular conversation that my family, that we have amongst ourselves of what's to happen. If this happened, it triggers this, and this.
So people listening, death is not the end of the world, but it's a transition period for families. So talking about it, from what I hear from Miss Roy, is a good thing. And with me and my father, it turned out pretty good. Like we got time, we spent time together, we laughed, we actually created more memories in the conversation about death than we did in the conversation about things that we like. So it was a enlightening conversation. So Miss Roy, I thank you for coming here. I thank you for sharing the information. Is there anything else you want to get out to the people before we move on to the next segment?
Yes, I would just like to say if any of the listeners, if there's a need for hospice in your family, please consider Midtown Hospice or consider some hospice of your choice that is doing your family member a disservice by not allowing them to, I guess, expire with dignity and peace and not in pain. So with hospice, all these things are offered. I mean, the equipment, the supplies, and all the different perks that are very helpful to the family. So please consider, if you get an order for hospice, I would love to have the opportunity to serve you and your family in Midtown Hospice. But if not Midtown Hospice, please consider, some hospice. But once again, the number for Midtown Hospice is 713-874-1234. And thank you so much for having me today.
Thank you for being here. Again, this is the Let's Talk Business podcast. We're getting you guys this information. Miss Jennifer Roy has given you the plug on hospice, how to get in touch with them. Again, while we have a split second, I want to thank our sponsors again, Amico Federal Credit Union, Enlightened Enterprises in supporting this podcast, also Southwest Airlines. Also want to plug GMT Radio. GMT Radio is the place where we come to do our podcast without the help of Nice, because he is the man behind the scenes running all this, setting up the cameras, putting us out there. Go to www.gmtradio.com and also go on your mobile phones and download the app GMT Radio. They have podcasts. If you're doing videos, anything you want to do in media, GMT Radio is a great place to be. We're going to take a break here and come on with our next guest. Like I said, TriCounty Regional Black Chamber of Commerce. I'm your host, Howard Johnson, the Vice President. Thank you, Ms. Roy, again for coming out. You're welcome to come back anytime.
Thank you so much.
All right, we back on the air. Let's Talk Business podcast. I'm your host, Howard Johnson, the Vice President of Tri-County Regional Black Chamber of Commerce. Again, today is the 5th of March, 2021. Can you believe it? It just seemed like it was Christmas last week. I'd like to thank our sponsors, President Club members, Amico Federal Credit Union. Hey, if you guys are looking for a good credit union, this is a family-based, member-owned credit union, Amico Federal Credit Union, and Enlightened Enterprises. They support our podcast. Also, Southwest Airlines is a proud sponsor of Tri-County Regional Black Chamber of Commerce. Been with us for years. If you yourself would like to become a sponsor, you can reach us at 832-875-3977. Again, that's 832 excuse me, 875-3977. Again, like I say, we get the information. Today's topic is information for all. We have John Booman here. He's the Director of Development for the AIDS Foundation of Houston. Am I correct?
Yes, sir.
Okay, John, go ahead and introduce yourself. Tell people, I guess you can tell them what I said, and then and then tell them who you are and what it is you do.
Yeah, so my name's John Booman. I'm the Director of Development for the AIDS Foundation Houston, like you said. I am a fundraiser extraordinaire.
Okay.
I like to say for the
You go
AIDS
get that
Foundation.
money.
Absolutely. But I'm also a fundraiser with a heart. I
Okay.
tell people about what we do, and that's really a lot of pretty much anything you can imagine. We have everything from testing and prevention, which is testing for not only HIV but STIs, and prevention, and treatment. So prevention.
Okay, quick question. What's an STI?
STI is a sexually transmitted infection.
Okay.
It's like an STD, but
Uh-huh.
it's a little bit more. Instead of calling it a disease, we
Uh-huh.
call it an infection because it's
Yeah.
not something that
Mhm.
disease comes with a stigma, and above all else, we are trying to get rid of stigma.
They've taken the
Sexual-
word and changed it from what it really means. It's actually a two-part word, and the first part is dis, and the last part is ease. So
Yeah.
it's a dis-ease, which means a uncomfortable part or uncomfortable happening in your body.
Oh,
But
yeah.
they've taken disease and made disease, disease, disease. They plugged it and made it this negative word now. So I like it. I like STI
Yeah.
better than STD.
And an infection lets you know that it can be cured,
Yeah.
or treated.
Yeah.
It definitely there's nothing, especially with modern medicine. I mean we see it every day now, but there's nothing that we can't treat or cure as far as STIs go.
And here's the great thing. A lot of people are concerned about one thing right now. You haven't heard people talking about the flu. You haven't heard people talking about getting sick. All you've heard people talking about is COVID-19, COVID-21, the coronavirus. But you can still get the flu. You can still get AIDS. You can still get STIs. So those things haven't disappeared. This thing, COVID-19, has just blanketed everything else that's out there. But John's here today to kind of talk about don't get lost in one thing and forget about everything else. So let's hop right into it, man. What can you give us some statistics on STIs, or I mean, I guess is AIDS or HIV considered STI?
It is.
Okay.
It's a little bit more intensive than
Uh-huh.
most STIs, as is a retrovirus. So it's a
Mhm.
little bit more. It's not currently curable, but it is
Uh-huh.
treatable.
Okay.
You can get it down to where you are undetectable. Your viral load's undetectable, and that
Mhm.
means you can't transmit it. It's
Okay.
what we call U equals U, undetectable equals untransmittable.
Okay.
And how we do that is we work with our team, our prevention team at the
Uh-huh.
office, which can be reached at 832-436-3798
Okay.
for a free test. We call it free 99 is what our CMO likes to call it.
Uh-huh.
And you can get in contact with us, get that free test, learn if you are HIV positive, and then immediately that day we can get you on treatment for it, so that
Okay.
as soon as possible get that viral load down and make sure that you're not transmitting.
And then, how often do you recommend? I guess. Okay. So, first question: who do you recommend get tested?
Everyone.
Everyone. Okay.
One in 7 people in the United States that has HIV does not know that they have HIV.
Okay. And then, how often do you recommend people get tested?
As often as they deem necessary, but every 3 months. I get tested every 3 months.
Okay.
And I'm fairly safe.
Okay.
I'm very safe.
Okay.
But even then, even if you're with a partner, that we still recommend getting tested every 3 months because you never know.
Yeah.
And we want to make sure that
Exactly.
we want to make sure that everybody who even if it's
Yeah.
an STI,
Yeah.
we still want you to get treated for it because the more it spreads, the
worse
crazier
it can get. Yeah.
Yeah.
Yeah, and that's the rule of thumb back when I was out there. I did some stuff, so yeah. But if you have multiple sex partners, it's good to get tested on a monthly basis. And if you don't know that person's sexual history or their sexual activity in the time that you guys are together, it's just that easy for something to happen to them and they bring it back to you, and then you spread it to whomever it is that you're with. So
Yeah.
even if you're with the same partner, it's like John said, you never know. So it's always good to get tested. So I just encourage everybody, get tested, get tested.
Yeah, and
get
above
tested.
that, make sure you wear a condom.
Yeah.
Wearing condoms like wearing a face mask. You wouldn't go into a big crowded room full of people nowadays with
Yeah.
COVID-19
Exactly.
spreading without a face mask. You don't want to
Exactly.
have sex with somebody you don't know without wearing a condom. So.
Exactly. So how long have you been with the AIDS Foundation of Houston?
So I am coming up on my first year anniversary, March
Alright.
25th. So right in the middle of all this.
How do you like it, man? How do you like working for the AIDS Foundation of Houston?
I love it because even in the middle of, so to give you a little bit of history, we started in 1982.
Okay.
In the middle of the HIV/AIDS
Ooh,
crisis.
yes, that was man, that was huge.
During
man.
the hardest part, so we know what it's like to respond to a crisis, especially a health crisis, and so. I like working for the AIDS Foundation Houston, and especially like it during this time because we've gone above and beyond to make sure that we are being innovative and really making a point to make our services more accessible. We have in-home testing through Mr. and Sister, which are our partner partner group that tests not only for HIV but for STI. And then if you test positive or negative, positive we can get you on treatment, negative we get you on PrEP, which is a once daily pill.
Okay.
And just to plug those real quick, it's Hey Mister MIST. It's HEYMISTR.com/AFH.
Okay.
And
Hey Mister is the partner company that comes out. They'll come to your home.
No, so they send you a kit.
Okay.
You don't have to talk to anybody else, see anybody else. You go to the website, which is heymistr.com/AFH. Put in your zip code. They'll send you a packet. It's a little finger prick. You give them a little bit of a blood sample there. You do a few swabs. Send it back to them. We give you a call, let you know you're all clean. Let's get you on PrEP. And that's for everybody.
Yeah, and that sounds like it's very discreet too. You know?
It is. It comes in a discreet little white package. Nobody knows what it is.
So if you want to do it and you're worried about who's gonna know or who's gonna find out, then they ship it discreetly. Nobody has to know. You don't have to talk to anybody. You don't get any calls from anybody saying this is this and this is that. So I encourage everybody get tested. It's better to know than not know. People say what you don't know will hurt you, but I say what you don't know could kill you. So.
And could hurt other people you love.
Exactly.
Yeah.
Exactly.
Because if you don't know and you go out spreading it, and somebody comes back and they're like, "I got this from you." I mean, I've never been there, but I mean, people have been there.
Yeah.
I'm sure it's not great.
Yep. I've been there in transparency. I've
Yeah.
been there. It wasn't AIDS, but we'll move on. Next subject.
Yeah.
that was years ago. Let me state that it was years ago. I'm telling on myself, but I don't care.
Yeah, but I mean, openness and transparency is how we normalize it, and how we know that it's not
how you make it simple. They're like, oh God, that guy right there, he talks business on the radio, and he did it. And he said he did it. So yes,
and it takes the stigma out of it too.
Yeah, I mean, people, and that's just like we were talking to Miss Roy in the last segment about talking about death. People are, if it's not normal, then it's weird. So to take the weirdness out of it and add normalcy to it is for people to be transparent. If something has happened to you and you want to help other people through it, the best way to help them through it is to be transparent about your own experiences. So people, and like I told her when I asked her questions about how she started her business, the transparency that she gave or the idea or the blueprint she laid out helps other people say, okay, well, she did it and this is how she did it and I can relate to her, so maybe I can do it too.
Absolutely.
And that's the same thing. It's like a big circle. It's the same thing with getting tested. Oh, well, he did it. And I think he's a cool guy, so maybe I can go do it too. Or he did it and he wasn't scared about it, so I don't have to be scared. When people can relate to you and then you give them transparency, it allows them to tap into things in their life that they may need to do or may have thought about doing but didn't have the motivation because they didn't see the same thing or see something similar in their life doing it. And
and that's what we're all about. I mean, we do everything. Like I said at the beginning, we don't just do treatment and prevention. We have housing communities that we work with and manage. We have Stone Soup, our food pantry. We have just a wide range, and we provide job resources throughout the community.
So what is Stone Soup?
Stone Soup is our food pantry, but it's so much more than that. It's we go out into our housing communities and into the greater Houston community at large, and we provide a month's worth of food every month at the beginning of the month. It's
Okay.
changed a little bit during COVID, as everything has.
Yeah.
We do it by appointment now,
Mhm.
which they can go onto our website, aidshelp.org,
Mhm.
and get the information on how to make an appointment to come pick up stone soup.
And so here's my question: what are the requirements to get the stone soup? Do you have to be HIV positive to receive
No.
from stone soup? Okay.
No,
So tell the people what the requirements are.
Yeah, so there's really no requirements. You just have to be in need.
Okay.
That's all that we ask. We want to make sure that we're helping the most people. So
Yeah.
the folks that are of the most need,
Mhm.
they can call our line and we can get them connected to get an appointment for stone soup.
People, are you listening? If you know somebody that needs these services, this information, we're providing this information for you. John's over here telling you, if you know somebody that's in need and needs some food, the program that they have provides food to people that are in need. So, keep listening. And while we got a quick break here, I always want to thank our sponsors. Our sponsors make this possible. Amico Federal Credit Union, again, I plugged them earlier. Great, intimate credit union. If you're looking for a credit union that will cater to your needs, they help the community, and they're also member owned. Amico Federal Credit Union, Enlighten Enterprises. They all support our podcast. Southwest Airlines supports our podcast. So if you're looking to be a supporter of the podcast, again, reach out to us, 832-875-3977, or you can go to our website, TriCounty Regional Black Chamber.org. That's TriCounty Regional Black Chamber.org. And our website kind of goes over everything that we have that we're offering. We have a bunch of events coming up. We have an event tomorrow, but it's actually sold out. It's actually fully booked. So we provide events for businesses. We help construction, logistics, administrative, marketing, service and products. We get you access to opportunities in the community, and more. So being a member of the chamber, plugs people into that community. At Tri-County Regional Black Chamber of Commerce, our mission is to we're committed to acquiring and disseminating valuable business information, resources, and tools for member firms to achieve entrepreneurial parity and economic prosperity in the region and internationally. So we basically get information and we get it to our members to allow them to have this information. Had you not sat there and said anything about the program you offer for people in need, then it wouldn't be out there. So, again, I thank you for coming today. What are some of the events you guys have? Do you guys have events? Let me ask that first.
So we have tons of events,
Okay.
And people are able to put on their own events. But the biggest one, our biggest one of the year, actually, is happening right now.
Okay.
March 1st to April 1st.
Okay.
It's our Walk to End HIV/AIDS Walk Houston.
Okay.
People can go on to AIDSWalkHouston.org
Okay.
and sign up for a team, join a team. We have tons of teams already signed up. I think it was 65 teams at the last count that I saw this morning.
Okay.
But come on, join a team, start a team, share it with your friends and family, and help us raise money to end the epidemic of HIV in Houston.
Okay. So how does the walk work? It's pretty much okay. So say I wanted to participate. What would be the steps I would have to go through?
So you go on, you sign up, and you can do pretty much whatever you want. This year, with it being virtual, it's a choose your own adventure sort of situation, where you can walk, run, brunch. Our chief development officer is gonna bake. I'm running. We have people doing yoga for it, everything, and just while you're doing that, share the mission of the AIDS Foundation. That's what we're all about. We're all about getting the word out there. That's why I thank you so much for letting me come on here and talk about it.
Man, I'm glad you're here. It's our honor to have you here. So
absolutely. Yeah. And you just go on, share your fundraising page to Facebook, Instagram, Twitter, wherever you're at, LinkedIn, and really just make sure you're sharing that information, and people will donate. Like you said, when you share your story, people resonate with that.
Yeah. Yep.
and it brings people to the cause and helps them donate.
Okay. Let's see. Is there anything else you want to tell the people about the AIDS Foundation, or about pretty much anything that you guys do? Any notes that you have that you want to get out here while we're on the air, while we have this platform? Let's plug it in, John.
Yeah, above all else, I just want to, like I said, thank you so much for letting me come here. Our mission to end the epidemic of HIV starts with testing and treatment, but it goes so much further. Like I said, I mean, we reach into pretty much every part of somebody's life, and so you can find out, and the listeners can find out more at aidshelp.org.
Okay.
Find out about our supportive services, like job resources, things like that, all ways that we connect with the greater Houston community, because while, you know, HIV can affect anybody, it affects black and brown communities especially, LGBT community, all of those places, all those underserved places are more affected by it. So being able to come on and share that.
I'm gonna put you on the spot. You have any statistics on that?
Let me check.
If you don't, it's cool.
Yeah, so of people who are newly diagnosed every year, black gay men are 25%.
Wow.
Of the newly diagnosed, and that comes from the CDC directly.
And black gay men are still the minority. They're still the minority.
Well,
like it's a shortage of men, period. Then it's a shortage of black men, period. And then you guys make up 25% of, you know, the new diagnosis. So, you know, it's still, that's a high number. 25% is a high number.
And it's that intersection. It's because the black community is underserved and gets more infections, and then the LGBT community is underserved and gets more infections. So that's, we target everybody. We want to make sure that everybody has it, but we want to especially make sure that the communities that are hardest hit are the ones going out, getting tested and getting treatment.
And that's what TriCounty is all about. We try to help the underserved communities, which is, you know, a lot. We help minorities. We do it for minorities. We'll help any and everybody, but we are, you know, strictly here for the minority community because it's an underserved community. That's why we say we disseminate the information to offer entrepreneurial parity, which means we allow them to compete, not as a minority anymore, but as a business owner. So we help businesses get, like I say, information, tools, and resources, whether it's Hub certification, DBE certification, the different certification to get government contracts, government jobs, city contracts, you know, the different entities, TxDOT, Department of Transportation, which is TxDOT, the Texas criminal justice system, the Department of Criminal Justice.
And we work with them as well. Our Bridges to Reentry works with recently released folks to get them housed and to help them test for HIV and STIs. So we work with TDCJ as well. So,
and it's
like I said, we're everywhere.
Yeah, it's a lot of things that, you know, people can do to help, and I'm really glad that you guys came on today because, like I say, the light is being shined on COVID-19, but there are still other things out there that can and do happen to people, and, you know, STIs are one of them, and getting tested is, you know, very important. It's right up there with the importance of oxygen. If you lose oxygen, something happens to you.
Yeah.
Right.
Yeah.
So yeah, getting tested is like I say, I just encourage people to, you know, to go out and get tested.
And like I said, we take insurance, but if you don't have insurance, we're free. So come to us. We will get you tested for everything you can think of, and then send you off either with treatment or with a clean bill of health and
that's
some
perfect.
prevention.
That's perfect. Again, you know, like I say, I thank you, John, for coming on, the director
so much for having
of
me.
development. Tell people how they can get in touch with you guys again.
So y'all can reach out to us directly at info@afhouston.org. We monitor that account.
Okay.
And you can also call 713-623-6796. That's our main line. and they can get you connected with any resource that's out there. So yeah.
Okay, perfect. Well, are you a native Houstonian?
I'm not a native Houstonian.
Where are you from?
I grew up in a little town in West Texas called San Angelo.
Oh, you still a Houstonian.
I've lived here since
West,
04, so.
West Texas is, yeah. You're not like me. See, I came from Michigan, so I'm
Okay.
imported, but I've been here for 23 years now, so I've been here a long time.
I've been here for 17 years now.
Okay, see,
So,
I've been here longer than you. Yeah. So, but yeah, so being from Houston, being in business. Hey, look, if you guys are looking for great chambers, this is a good chambers. You can hang out with me. We're
Okay.
kind of wrapped up, but I'm gonna take some time to plug the chambers and tell you, you can kind of listen in on what it is we do here.
Oh, yeah.
Like I say, we're connecting your business to the money. We know business. Our members make business happen. Like I say, we deal with a bunch of people in our network, a bunch of businesses in our network in construction, logistics. In the construction and logistics, we have a program. Gosh, I have just a truckers alliance. We have a construction alliance and a truckers alliance that allows trucking companies to align with each other, come together and compete for bigger jobs. The same thing with construction. It allows construction companies to align with each other and compete for bigger jobs. We help with administrating, marketing. We also have an opportunity for businesses to sponsor a small business. All of this stuff is on our website. Like I said, again, we have our 2021 business book. And man, it's full of all of our platinum members. And I guess while I have a second, I'll go down that. So our platinum members are Amico Federal Credit Union, CBR Pros Construction LLC, Satoga Logistics LLC, Enlightened Family Care, Houston International Trade Development Council, U of H Hub Operations, I Am Design, The Print Box, Stay Sharp Enterprises Incorporated, Classy Pineapple LLC, Bradlink LLC, Jasper United Insurance and Tax Services, Metropolitan Transport Authority, Permit Us Now, Texas Health and Humane Services, Midtown Hospice, INC. That was Miss Roy that was just on here. Yep. Bayou Behavioral Health Services, the University of Texas, which is the UT System Administration. So we partner with UT to get our members out to them, and they have minority participation, so they need us and we need them. Anointed Caring Homes Incorporated, Lamar Institute of Technology, Dreammaker and Secure Tax Services Inc., Texas Department of Criminal Justice, Southwest Airlines, Mesa Oilfield Logistics Inc., Texas Health and Humane Services, T&D Tax Services LLC, Bayou City Operators LLC, Island Tattoo Studio, which is a tattoo studio in Galveston. I'm going to see them. Not just keeping your kids safe. KYKS, which is Tabitha Barone. We had her on the show back in February during Black History Month. 707 Management LLC, which happens to be my company.
Okay.
The Wilson Family Caring Center, PO Consultants LLC, AIDS for Home and Health Care Services. Not AIDS, but AIDS. Help. Best Personal Care Facility. So those are some of our platinum members. We have gold members. J. Raphael Photos, LLC. That's my boy, J. Raphael. World of Color Development Center, Premier Choice Limousines and Transport, Airway Control, LLC, the Soulco Group, Curian Consultant Group, PC Optics. We have a bunch of members. We have a great network here at TriCounty. Like I say, get with any of the members, vice presidents here, Ms. Thompson. Make sure when this book is available that you pick up the book. It's our 2021 business book. It has full page ads in here, different ads that talk about the businesses. All of these businesses that are in here, I hope they are all members. I know most of them are. Most of the names that I went down are members of the chambers. But these are the type of things that we offer. You really don't have this where you can go and pick up a book and flip through it and say, oh, I want to get a tattoo. Well, you might not even been thinking about it. You might just flip it through the book. Oh, that's a tattoo artist. I can talk to them. Oh, I need behavioral health, like the lady was talking about the hospice. Oh man, my sister was talking about hospice. I have a place right here. So it's actually a wealth of information just inside this small book, and that just says what the Chambers does for people and businesses. We get information out there. Like I say, and then we have a bunch of events coming up. Next week we're going to have MD Anderson on the podcast. He'll be on the podcast virtual. They'll be talking about the services that they provide and what they're going to be doing with the chambers and getting stuff out there. And man, it's just, I love to sit here in this chair. I love to meet new people. I love to hear people's story. Man, John, I really thank you for coming out and spending some time.
I got my copy of the book too.
Oh,
so
perfect.
I'm gonna
perfect.
keep it with me. Yeah.
Perfect. Yeah, I thank you for coming out and spending some time with us today. Again, let me go in and thank our sponsors, Amico Federal Credit Union, Enlighten Enterprises, and Southwest Airlines. Really want to thank them. Hey, people, GMT Radio. www.gmtradio.com. My boy, nice. If you have any type of podcast, radio show, TV show, commercials, videos, anything you want to do dealing with media, GMT Radio is the place. Go on their website, www.gmtradio.com. Go to your mobile app, go to your Play Store or your Apple Store and download the app, GMT Radio app. Man, I have it on my phone. You can watch TV shows and stuff on there, man. They call the man nice for a reason because he is nice with it. Again, this is ending our podcast. Please tune in with us next Friday, March the 12th, 2021. Can y'all believe we are in March?
That's crazy.
This is the middle of March. We had a great month last month for Black History Month. Again, next week, MD Anderson will be our guest on the podcast. And I probably will be hosting. I'm not 100% sure. I may be the host, may not. But anyway, tune in. Like I say, we got a wealth of information. And if you missed any of our podcasts, you can go on TriCounty Regional Black Chamber of Commerce.org and click on the Let's Talk Business podcast and watch any of the previous podcasts. You can check those out. Again, John, thank you for coming out, man. I'm your host, Howard Johnson, Vice President, Tri-County Regional Black Chamber of Commerce. I'm also the principal at 707 Management. We are a custom home builder. We also do project management in construction for all facets, whether it's K through 12, university, commercial, residential. I pretty much can help you out. If you have any questions, construction, it's free to talk to me. 281-726-1028. Again, that's 281-726-1028. And my website is www.707llc.com. Thank you.